Good afternoon. Thank you for joining. We'll give it another 30 seconds or so to let folks jump onto the webinar, and then we'll get started. In the interest of time, I'm going to go ahead and kick us off. I'll say out loud to start that we are recording this webinar, and it will be on Schoolhouse Connection's archived webinars page in about 24 hours. So if you have colleagues who weren't able to join or who are late getting in, have no fear, you will be able to access this recording after. I want to thank you for taking the time to log on and listen to this really timely and important topic and hear from our Connecticut friends about the Connecticut Head Start on Housing pilot program. Just a few introductory notes to start. My name is Erin Patterson. I'm the Director of Education Initiatives at Schoolhouse Connection. And in just a moment, I'm going to turn it over to our Executive Director, Barbara Duffield, to get us started today. If you're not familiar with Schoolhouse, we are very glad that you're here. We are a national nonprofit advocacy organization, and we are committed to overcoming homelessness through education. And today's topic couldn't be a better example of why we say that. We recognize that the more education a person is able to attain, the less likely they are to experience homelessness. We work across the early childhood, K-12, and post-secondary sectors of education through policy and federal and state policy and advocacy, practical assistance to early childhood programs and school districts. And we always say the jewel in our crown is our network of young scholars who have experienced homelessness themselves and who receive financial support from Schoolhouse Connection to pursue their post-secondary education, as well as some intensive case management support as well. You can visit our website, schoolhouseconnection.org, to learn more and to access all of our resources and tools. In just a minute, I will share our lineup of amazing presenters today, but for now, I'm going to hand it over to Barbara Duffield, who's going to give us an overview.
Thanks very much, Erin. We are thrilled about today's webinar because it's bringing together the two topics of early childhood homelessness and housing agencies, and really doing some very creative and much needed work to bring those two systems together. For those of you who are new to this topic, a little sense of scale. The last information, the most recent information that we have from the U.S. Department of Education estimates 1.3 million babies, toddlers, and young children under the age of 6 experienced homelessness in 2018-2019. So to put that into perspective, that's about 1 of every 18 young children experiencing homelessness under the age of 6. These are obviously pre-pandemic numbers and their estimates, so we know that the numbers are actually probably much larger. The other important thing we want to point out is just the prevalence of young parents who are experiencing homelessness and who also have young children. So we know from Chapin Hall at the University of Chicago that 44% of young women between 18 and 25 are either a current or expectant parent to over 1.1 million young children. So again, thinking both about the ages of children and the ages of the parents and the work that we need to do to cross those family and youth homelessness silos. On the next slide, a little bit of information about some of the racial and ethnic disparities that we see in homelessness and housing challenges. This information coming to us from 0 to 3, looking at the disparities among infants and toddlers who live in crowded housing, which we know has an impact on child development, and the percentage of babies and toddlers who moved 3 or more times since birth. And we see that Hispanic, American, Indian, Alaska Native, and Black babies have much higher incidence of those housing conditions. So as we work to address the issues of early childhood homelessness and housing, we need to keep those disparities in mind as well. Looking at the impacts of homelessness on young children and the prevalence, one of the pieces of information that we like to really remind people, because it's so invisible, is that infancy is the period when in a person's life when a person is most at risk of entering a federally funded homeless shelter. So we don't often think about that because of the invisibility, but really important to keep in mind that high prevalence among our youngest children. And we know too that homelessness is much more than a housing problem. It has many systemic drivers and many complex causes. And again, a perfect reason for bringing together Head Start and our housing agencies. And the last piece is just that once the family is experiencing homelessness, they do face multiple barriers, both to accessing early childhood services, which are so critical for child development, but also to accessing housing systems. And again, this is why we're so excited about today's presentation, because whether it's restrictive definitions of homelessness, whether it's prioritization systems through the HUD homeless system, whether it's just the bureaucracy of applying for housing, while we work to create safe, affordable housing, we also need to be very intentional about how families access those services, those housing services. And Head Start could not be a more perfect place. Lastly, just a note on the impact on child development for homelessness. Is lasting. And this is, again, critical why we're focusing on early intervention, intervening as early as possible. We know that homelessness in infancy has been associated with delays in language, literacy, social emotional development, which puts children at risk for later academic problems. We also know that the younger and the longer a child experiences homelessness, the greater cumulative toll on negative health outcomes. So again, there's the imperative for acting early as possible. And then finally, we know that the impacts of homelessness on young children are long lasting, even once families are housed. So that means, again, focusing on the wraparound services and the long-term supports provided by partners like Head Start, who stick with families while they're experiencing homelessness and also once they're housed. And with that, I will turn it back over to Erin to moderate.
Thank you so much, Barbara. That was the perfect setup and the perfect segue, because we do know that Head Start is well positioned to make these connections. And so I'm happy to turn it over to Dr. Deborah Bergeron with the National Head Start Association, who can tell us exactly why this is so important to Head Start.
Thank you so much, both Barb and Erin. It is so much fun to work together with your organization, because of its mission and how aligned it is with what Head Start is doing. And I think back to the first couple of weeks, maybe month at the Office of Head Start. And I think I had a meeting with Barb is what started this thinking. And then I was listening to lots of programs say they couldn't fill slots. And I was thinking the numbers don't make sense. We have well over the number of homeless children who are categorically eligible for Head Start out there then we even have slots. If we filled every single slot with a child experiencing homelessness, we'd fill all of them. And so really tried to ramp up that Home at Head Start campaign that put a focus on children experiencing homelessness. And the response was very heartwarming, because I got messages from directors who would talk to me about how important it is that they keep that front and center. And sometimes it's really challenging to do that. I think what you talked about, Barbara, about access and, keeping in mind the challenges that sit between a parent and accessing even something like Head Start, which seems like such an easy entry point, but it isn't always like that. So I think Head Start brings a unique set of resources to the table. And because it is whole family, has the greatest opportunity to make a significant impact on all of those markers that Barb touched on. So I'm very excited to be here. I love seeing this kind of innovation at work. And I'm really hoping that this is the catapult forward to get this into the hands of as many of our programs as possible. So thank you so much.
Thank you. And before we jump into our amazing Connecticut team, I just want to let our audience know you can use the chat box or the Q&A box at any time throughout the webinar to share any questions that you have for our panelists. We're going to go through our panel, and then we will open it up to that Q&A as a roundtable discussion. So we encourage your questions throughout. And now I'm going to turn it over to the Connecticut team, who will be kicked off by Elena Trueworthy. And Ruthie, I think you are all set to share your screen whenever you're ready.
Wonderful. Thank you so much, Erin, and thank you to Schoolhouse Connection for your leadership and your partnership in this work, and also to the National Head Start Association as well for being such a supporter and really bringing all of this work to light. We are really excited to be here as a Connecticut team to share our work and our experience and our lessons learned and our excitement around this work of the Head Start on Housing program that we have launched in Connecticut. And so when we think about, our early Head Start and Head Start families, we know that housing instability is one of the major challenges that our families face. And so in Connecticut, we have been able to bring together a team of partners that really bring their resources to bear, that really bring their strengths, and really underscore just the importance of collaboration and partnership. And in my role as Connecticut's Head Start State Collaboration Office Director, this is what we're in states to do, right? To set that table, to make sure that partners have the ability to talk to one another, to collaborate and to partner, to really make sure that our families, our Head Start families, have what they need to thrive, and that our Head Start programs also have what they need to support families to do this. And so when we think about our work with Head Start on housing, what exactly are we doing? So we are ensuring direct access for our early Head Start and Head Start families to housing vouchers. And so this has really been a game changer, I think, for the work that we do in Connecticut around the connection between early childhood and housing, and also has been a life changer for the families that we have been able to impact. And so, and it really underscores the model of Head Start, those comprehensive services, the ongoing continuous support of not just a child, but the whole family, and working in partnership with our community partners. And this has been, a longstanding relationship and partnership with our housing partners in Connecticut, and some excellent work that has been done to date. And we're building off of that. We're really springboarding off of that to ensure that direct access to housing vouchers. So I do just want to hand it over to Jacqueline Valley. She is the Director of Early Childhood Initiatives for the Enfield Public School System, and has been one of the programs that has been a part of this pilot as we launched it forward. And she's also the new co-chair of the Connecticut Head Start Association. So Jacqueline, will you tell us a little bit about your experience with Head Start on housing?
Yes, thank you, Elena. And as Elena said, referred to those comprehensive services that Head Start really stands for, my experience to date with this program, it really has exemplified that comprehensive service with a spotlight on community partnerships in terms of the larger systems and the smaller details. And I'll get into that as I share the story of a family that has gone through the program. But that spotlight on community partnerships exists both in my small community, as well as across the state, as you'll learn from the story of the family that I am going to tell you. So I have a family who attends Enfield Head Start, and mom was living in New Haven County in Ansonia, Connecticut, so it's over an hour away from Enfield. She had to flee a dangerous, violent situation, and she called 211, and they told her they could not help her because she had to follow a different process and call Safe Connect, which she did. They referred her to the umbrella, and she is very self-motivated in terms of finding resources, et cetera, for herself. So she started just researching things on the internet for where she was going to go with her 2 young children, and how she was going to get there and all of that. She found the press release or the press conference around this pilot, and she was very quickly able to contact the Office of Early Childhood, who was then in touch with us in Enfield. And I'm going to flash back a little bit in her journey. Once she was referred to the umbrella and there were restraining orders in place and agreements that happened and she really had to get out, they referred her to the network. Now she drove, because at that time she had a vehicle, and she drove from where she was living, and her car broke down in Hamden, Connecticut. So this poor, you think of all the barriers that this woman is facing with her 2 young children. And she said, I don't know what happened, but I called the umbrella and I said, I need help. I need to get a ride there. I can't afford an Uber. Someone has to get me to Enfield. And she said they went above and beyond. The tow truck driver was so kind to her and her children, drove her to a safe space until the Uber got there. And then they drove her to Enfield. And she said that was on May 5th. And she's been here since. She immediately was in touch with the OEC, like I said, and she had applied to Head Start. We reached out to her. Now, by the time all of these things fell into place, it was right before the last day of school. And I had already spoken to Jen at the OEC, and we were immediately finding her paperwork. Let's register the child so that she can start school and then attend summer programming and also get some transportation so that we can look at nutrition, education, connection, etc. When we met Mom, we did share with her that we were going to start this process of getting her a housing voucher and meet with the team and outline everything. But while she was here, she was so lovely when she was with other children in the classroom at dropping off and with her own children. And we, as everyone else, are also in need of staff. And so I asked her if she wanted to apply to be a teacher assistant, and she did. She did a beautiful job in her interview. All of her background check was great. She is now a staff member here. So we were able to also connect her and have her do her orientation and everything with the team. So at the John D. Amelia Foundation, the work, I believe it's Anna, I don't want to say her name incorrectly, and Stacy and Betsy, and we were able to meet with her and give her time to make these connections. And we brought in one of our strongest partners in our community, which is a social worker through the Family Resource Center. And that social worker, along with our family advocate, which is an invaluable part of Head Start, we're able to work with Mom to complete the paperwork, get her application in, etc. And then both of them, the family advocate and the social worker, visit different apartments that are for rent with Mom so that they can talk about questions that Mom might forget or not think to ask in that moment. And they also are there to advocate for her because, as we've learned through this process, there are barriers for people facing these challenges, and some landlords do not want to rent to people who have a voucher. They have a preconceived narrative. We're trying to shift the narrative. We're sending letters of recommendation. Our staff who has worked here and they're a little more vetted in the community are standing there right alongside her, please help us find her housing. So that's really, really nice for her. So that's been going on. She has looked at multiple spaces that she could live in. One of them, the landlord just would not accept someone renting through a voucher. One of them did not pass the inspection. The landlord would not fix the repairs that needed to happen. And now we are, fingers crossed, waiting to hear today if she has gotten another apartment. But the realtor who she's working with was a connection through the team, through the OEC and through I'm not really sure where their team comes from, but Stacy and Betsy, all these lovely people, had a realtor that they'd been working with that have found housing for families in these types of situations. And so the apartment that they're looking at actually comes with linens. And so when I say small details, it's fully furnished and linens. And Mom came to me and she said, it has linens. I don't have to find towels. And so you think about, oh, great, here's a voucher. You have housing. Our job is not done. The bigger system of finding her housing, of course, is super important. However, those smaller details, okay, so now she's going to need plates for her kiddos and sheets for the bed and, somewhere for them to keep their toys, etc. And so in partnership with all of the other community agencies like our Family Resource Centers, social services, social worker, family advocate, family support office, there's lots of people working together to help them. And we think it's really important because, as we know, their overall health of a family or child, an adult, is not just reliant on visiting a doctor or going to a dentist and physically caring for yourself, but it's those other health determinants. So this process is going to provide this family with safe housing. They have a sense of belonging and they have roots now in our community because they're part of our program. Our school, Mom works here. The children go here. They have education, the children, and Mom is going to have access to furthering her education through working for Head Start because that's another part of those comprehensive services. There's nutrition because we are serving her children breakfast, lunch, and snack every day. Mom can also eat with the kids when she's here because they're doing family style eating. And this is another smaller detail, but to Mom, this is huge. Her children get transportation to and from Head Start. Mom does not have transportation, so she's Ubering. She, having the position that she does of a teacher assistant, can serve as a bus monitor for us. And so we're working with the bus company to see if they can pick Mom up with her kiddos first. Then she does the whole route with them as the bus monitor. They come to school. And then when they leave, she serves as the bus monitor and she's the last stop. So it allows her to pay less for those things like Ubers and other means of transportation. And she's not relying on our town transportation system, which can take her over an hour to get here, and she's not always consistent with her time. So again, there are barriers. We've learned about them, but it's overwhelmingly positive, the progress that has been made. All of us in this school community feel grateful to this program because it's helped a family. The staff is so excited to see mom and the children every day and hear the progress, and everybody's rooting for her. So it really is incredible.
Thank you so much, Jacqueline. Thank you for your innovation, really, and your ability to really understand what are the needs of the whole family and how to really capitalize on the resources, partnerships that you have at the local level to make that happen. I mean, to think about mom being a bus monitor to ensure transportation to the program for herself and her children. I mean, these are just examples of those wonderful comprehensive services that Head Start offers. Really want to acknowledge the work of the National Center on Housing and Child Welfare. And when Jacqueline was talking about really understanding what it needs to work with landlords, the expertise that's needed to understand how both the housing system works and the Head Start system works, and bringing those connections together. Just the invaluable work that the National Center on Housing and Child Welfare has provided to this work. Thank you. Next slide. I'd like to introduce now Jennifer Jones, who is my wonderful colleague at the Connecticut Office of Early Childhood.
Good afternoon. Thank you, Elena. I'm Jen Jones. I'm an education consultant here at CT's OEC. Jacqueline's story, I've heard it a couple of times and it's given me chills, even as we sit here now. But how did we get here? Through some amazing partnerships and some innovative work across our state agencies and with the National Center. Back in January, the Department of Housing here in Connecticut earmarked 25 rental assistant RAP vouchers for families of children attending our Connecticut Head Start and Early Head Start programs. So we started out with 25 vouchers. In June, the Governor Lamont and our state agencies announced that we'd be receiving 35 additional vouchers, Section 8 this time for this initiative. And at the same time, the Department of Housing here in Connecticut has also changed their administrative plan to have annual vouchers available for Head Start and Early Head Start families. We are working to better support and align with our current coordinated access network and with the goal of ending family homelessness in Connecticut. Next slide, please. So our partners, Connecticut Department of Housing, we 100% couldn't do this without Steve DeLilla and his wonderful staff at Housing. Connecticut Office of Early Childhood, myself and Elena with our Head Start Collab office, the National Center for Housing and Child Welfare, Ruth White, and you'll hear about Betsy and Stacy, the ones who are knocking on landlords' doors to get houses for folks. And then the Connecticut Head Start Association, we'd be remiss if we didn't mention that not only is Jacqueline the Head Start Director in Enfield, but she is also the co-chair of the Connecticut Head Start Association. And without that partnership, we would not be able to continue to expand this initiative. So our current Head Start programs that are participating in this that have received either REP vouchers or will continue to receive Section 8 vouchers, the Alliance for Community Empowerment in Bridgeport, LULAC Head Start in New Haven, ACES Early Head Start in Middletown, Stowe Early Learning Center in Enfield, that's Jacqueline's hometown, ECHN Head Start in Manchester and Vernon. And as we continue to expand, we want to grow the not only partnerships, but programs that we're serving across the state so we can meet the needs of all homeless families throughout. Next slide, please. Elena.
All right, so how did we get started, or what does this flow and partnership really look like? And so, you know, when the National Center on Housing and Child Welfare, along with DOH, Department of Housing, really came to us and said, you know, this is an excellent opportunity to really think about the crossover and the connection to Early Head Start and Head Start. We really started to think about how do we start to do this, you know, small and then grow from there. And so we reached out to our Head Start grantees within Connecticut and started to have conversations with them around, you know, who is doing, who has some strong partnerships in their community with their housing partners, who's ready and willing to do some of this work to launch this, to make happen. And so we had some great feedback and interest from Head Start programs across the state, and started with 3 pilot sites and have since grown from there. So the Head Start staff are really in charge. They know their families best, right? This is not anything new to Head Start. Everything is built upon relationships and that partnerships with families. And so they know the situation that their families are in, right? Whether they're entering the program categorically defined as homeless, right? And defined as McKinney-Vento, which is the definition that we're using for this work. Or whether their situation just suddenly changes and they all of a sudden are in a dangerous or challenging situation as well. And so the Head Start programs, through that relationship, identify the families that will receive these vouchers. And we have a limited number of vouchers. And so we identified the number of vouchers that each of the Head Start programs would receive. And so the Head Start staff support the families in identifying the needed paperwork. They receive training and support both from the Department of Housing and the National Center on the type of paperwork needed, the type of information to complete those housing voucher applications. We have been so fortunate to have DOH that already has a system set up that we were just able to come into, where Head Start programs can upload the housing applications directly to an online system that DOH and their housing authorities, statewide housing authority, run. And so we have access to the information, who's uploading applications, what the status of that application is as it goes through the process. And then again, working with the National Center, who has brought that expertise through their ECHO team, their early childhood housing outreach team, to work with landlords, to handhold where needed, Head Start staff to work through the process and the families until they receive a voucher, they find housing to get leased up, and then they're in their permanent housing situation. Next slide. So I now want to hand it over to Steve DeLilla, who, as Jen mentioned, we couldn't do this without him and the leadership of the Department of Housing.
Thanks, Elena, and thanks everybody for having us here today to explain what we've been able to do in Connecticut. And that's a great place to start. How did we actually get here? And I think it really comes down to the vision of some of our leaders in the state. You're going to hear from Ruth White a little bit later, and she really got on to both my commissioner, Commissioner Mascara-Bruno, as well as Commissioner Baia of the Office of Early Childhood, and say we really need to do something, especially when the emergency housing vouchers that HUD released specifically for homeless individuals and households due to the COVID pandemic. And what we really learned through that process is we really do need to make households with young children that are enrolled in either early Head Start or in education in general eligible for some housing programs. And sometimes we get stuck because there are different definitions of homelessness between the Federal Department of Education as well as the Federal Department of Housing and Urban Development. And oftentimes we kind of get stuck in that definitional morass and we really can't make progress. But through the great leadership of both of our commissioners, who said we got to figure out a way that we can cut through that. And in Connecticut, we are lucky enough to have our own state-funded rental subsidies. So my commissioner offered up 25 of those state rental assistance program vouchers, really to get this program started. Connecticut has a long history of providing permanent supportive housing. So being able to flip that to this population was relatively easy. We have a really strong network of providers, and we were happy to include the early Head Start providers really into that network. And we also have a strong contractor who really administers our programs. And I think we've heard mentioned both by name, John DeMillion Associates, as well as some of the previous slides that say JDA. And they really are the ones that do all of the paperwork for us for our Section 8 and our RAP programs. And they're really the key players here in really moving the process along and getting folks to get into their housing so they can become stably housed. So we were really, really excited about that opportunity to do this by seeding it with the 25 rental subsidies from the state funding. But we also knew that that was unsustainable because everybody understands that within state budgets, we are limited within our budget. That's when we really tried to get as creative as possible and look on, try to determine how we can really keep this program going. So one of the things we've actually done with our Section 8 program that DOH also administers, because we also are not just the State Department of Housing, we're also a public housing authority. We have in the past done priorities for the homeless population. So we would say that 1 out of every 3 turnover units would go to the homeless population. So we said, why don't we do the same here? And for the early childhood population, for those who are housing unstable. So we actually made a change to our administrative plan to allow that. So now we have 1 out of every 3 turnover vouchers going to this program as well. We expect that to lead to about 50 to 75 new vouchers every year. So we're really excited about the opportunity to really continue this program. Now, one of the big pieces of this is landlord engagement. And I think everybody would probably realize that housing around the country, and obviously in Connecticut, is very, very expensive now, and it's very, very difficult to find due to the pandemic. A lot of landlords in our state have kind of backed away from renting out units because of what happened in the pandemic when tenants weren't paying. We also had a little bit of influx of population from New York City kind of coming in, so that led to even a tightening of the market. So it really became challenging to kind of kick off a new program in those times with a limited rental market, and obviously with costs increasing dramatically, that made it even sometimes difficult. Even though we did have vouchers, sometimes our rates of fair market rent wouldn't actually keep pace with what we were seeing. So luckily we were able to fix some of those things, but we really needed to get people who are experts at really trying to find landlords. So we were certainly lucky enough to be working with Ruth and her staff, who really committed a couple of stellar people who have history in Connecticut to really do the on-the-ground work of actually reaching out to landlords, explaining the program to them, and say, hey, why not take a chance here? A lot of times Section 8 gets a bad rap, so I do want to get a little more information on that one who said they wouldn't accept Section 8 in Connecticut, because actually it's against the law in the state of Connecticut to not accept Section 8. So we'll do a little investigating on that, because there certainly are a lot of positives to having a voucher. The landlord will get reliable on-time payments, and if there's any issues, especially with these programs, they have somebody to call. And that's what we've really seen is really what landlords are looking for, is if there are problems, they have a contact person, not just somebody at a housing authority that says, you know, well, those are the program rules and there's only so much we can do. When you actually have a case management staff there, they can actually work with the client and really try to understand what are the problems. Is it they're not paying the rent because they lost their job? Okay, well, how do we mitigate that? Is it because they're having, you know, guests over that are disturbing, or is it a child issue or another issue? And we can really work with them. And I think that really is super important to make these programs as successful as possible. So it really just became a natural choice to really move our programs to really look at the early childhood population, because we've really done in Connecticut, when we try to address homelessness, we've really worked from the back way forward. And what we've really done is we create a huge stock of permanent supportive housing for those folks who have been homeless for a long time. But as we see, you know, that is great, but what we really need to do is kind of look more to the front door. How do we prevent households how do we prevent households from becoming homeless? And one of the ways to do that is to really work with our partners who have a better understanding of the families that they are serving, and really who understand what their housing barriers and housing challenges are. So that's what's really great about this pilot, is we put that kind of perspective and that kind of power into our partners' hands to really identify those families. And so far, they've done a great job at that. And we've really been able to identify housing unstable families, or literally homeless families, to really give them the voucher. And we really do anticipate that providing this level of service and providing that stable housing in concert with the early Head Start programs and early education interventions can actually break some of the cycle of homelessness that we often see with the folks that we serve. And we're really, really excited about what this is going to mean in the long term. And we really do believe that this has that opportunity to really lead to success for the families and the children as we go forward. And our ultimate goal is also to look to partner even further with our state Department of Education and really look at some of those other McKinney-Vento families that are out there and how we can kind of incorporate them into this pilot. Because we know that although getting early intervention is really key to really setting children up for success, we also know there's a whole other world out there that are already in school, and we don't want to leave them behind either. So we're really trying to be innovative in how we include and incorporate that population of households and families as well. So we're really looking excited at that. And we just love to get as many landlords as possible into this program so we can have as much housing opportunity available. And I'll pass it back to you, Elena.
Great. Thank you so much, Steve. And I have to say, I've learned so much from the housing side of things. And I think they've learned a lot more about Head Start as well through this partnership. So what's next? I mean, we are just going to continue down this pathway of recruiting and expanding the pool of landlords, identifying more families, spreading this out more statewide to more of the Head Start programs across the state. And as Steve just mentioned, really starting to think about and work intentionally with our partners at the State Department of Education as well. So I think next, Ruthie, will hand it over to you.
Thank you, Elena. So this has been a pretty magical ride. I want to acknowledge that Connecticut was really in a great place to do this work. I mean, there is a over 20-year history of sharing resources across the Department of Housing, the Department of Social Services, and the Department of Children and Families. So I've been a student of that work for many, many years. But the person who really decided it's too late to wait till a family is at the doors of a child welfare system, you know, facing a termination of parental rights in the face or a placement of a child in foster care. The person who really figured that out, that that's too late and we should start with Head Start, was our staff member, Betsy Cronin. So when Jacqueline was mentioning Betsy, Betsy does everything from design programs to get in her car and go out and try and convince landlords to, you know, see the light. So what we're doing in Connecticut is really working hand in hand with the Head Start staff who actually do a lot of those things. And many of them know how to do landlord recruitment, but in the event that they didn't know how to walk through the Section 8 process, we do that beside them and they learn how to do it as well. So the other thing is Connecticut does have this robust network of John D. Amelia and Associates, basically public housing authority staff embedded all throughout the state, courtesy of Steve DeLilla and Commissioner Bruno. So Connecticut was ready to go, but our feeling is any community in the country can do this. If you get the ear of the state leaders, you can do this. So I'm going to tell you a little bit about that. But I do want to note that the Commissioner Mosquera Bruno of the Department of Housing is very clear about this. When Betsy and I approached her about this, she said yes immediately. She did not need a dissertation. She said yes. So why can't all the commissioners do that? That should be an inspiration to all of us to expect that of our commissioners. A quick note about this gentleman and his child on the slide. This is one of the gentlemen who did receive a voucher. They were living essentially in a rooming house, but this child was enrolled in early Head Start and very active and very engaged with the casework, but they were in an unsafe situation. They were in a rooming house where multiple people they did not know were in and out, and their childcare situation was a little dicey. So he is now happily moved into a beautiful apartment, but the landlord that owns this property, when Betsy approached him and told the landlord what was going on, the landlord said, I understand, I want to give somebody a shot. I have my own criminal record. Like I get it. So if you start talking to landlords, you realize that not all of these landlords are like corporate raiders. They're middle-class people, mom and pop shops, and they do understand, and often they want to be a part of this whole narrative of a Head Start on housing. So Fred and his son are doing great, by the way. So how might you do this in your own community? Again, we have a lot of respect for what Head Start agencies do, but this is, Schoolhouse Connection has illuminated the fact that McKinney-Vento liaisons out in communities are doing a similar set and complement of services. And it's really impressive when you sit down and you talk to a McKinney-Vento liaison. We can tap their expertise as well. But the reality is you just have to go talk to your housing authority. Who wouldn't want to sit in a room and talk to Steve DeLilla? I mean, come on, he's like a ray of sunshine. So you just have to create the opportunity to have these conversations. A quick response to some of the things I saw in the chat about HUD's definition of homelessness. We acknowledge that these families have, they mostly meet HUD's strict definition of homelessness, but that's not exactly the point. The point is, if you're going to refer someone for a Section 8 voucher, they have to be ready to use that Section 8 voucher. If they are not document ready, if they haven't selected what neighborhood they want to live in, if they haven't cleared up the arrears that they owe or something on their credit report, it isn't that they won't get a voucher, it's just that that needs to be dealt with first. We don't refer a family to John D'Amelia and Associates or a public housing authority until those things are figured out, but we do figure those things out. So our organization uses philanthropic dollars, and in some cases, if it's available state dollars, we pay the arrears. There's no reason for a family to be homeless simply because they owe $3,000 to either a public housing authority or on their credit report. So the key here is we figure that out first before they're referred for the voucher. Okay, we accelerate it, but we do that first. So the definition of homelessness becomes not a non-issue, but like less of a concern. The bigger concern for us is the family ready to go? Okay, so that's really what we did. And so we do cover, we do that either through philanthropic resources or again, by accelerating the COC process of getting access to transitory housing costs. And then whether this be McKinney-Vento or with the wonderful, robust statewide collaborative run by Elena and her colleague, Jen, we meet regularly and we check in, like, how's it going? Do we need to make any adjustments along the way? But there is no need to wait. So how do we expedite the process? We have created an approach here called early childhood housing outreach. And so we want everybody in all of these ancillary systems to be trained on the ECHO model. And we would like this to evolve into a scenario where every agency that touches the lives of a young family would have an ECHO professional, sort of a certified ECHO professional who understands housing, understands economic security, and can expedite the process. So that's kind of the expertise that it takes. We believe that McKinney-Vento liaisons should also get that distinction. And once you have that distinction, you can actually accelerate the process. I don't want to say that we're bypassing coordinated entry. I understand coordinated entry, we've built that up over 20 years and everybody wants that to work. But the way to help coordinated entry work properly is to relieve the burden on coordinated entry by working in tandem with that. So what we do is we report all of what we're doing to coordinated entry. In Connecticut, it's called the Coordinated Access Network. Not sure what it's called in your neighborhood, but it's often referred to as 211 or the COC. So you'll see on this chart that depicts how the referrals work. Any one of these systems could be a part of this. Currently, we are working with Head Start, but we're moving, as Lena said, we're moving into the McKinney-Vento liaison space. We want them to be a part of this and be able to refer quickly. But why couldn't someone in a maternity ward at Bridgeport Hospital who's about to send a kid to foster care because a new mother is homeless, why couldn't that maternity room social worker also be a part of this? So we kind of foresee a future where we'll relieve the burden on coordinated entry. We'll work in tandem with them to get access to these resources. But you'll see over here on the far left-hand side of this chart, to make this work or to kick this off, I will say that it took the National Center for Housing and Child Welfare to come in and pull people together. But thanks to the blood, sweat, and tears of all these professionals in Connecticut, we can do this much more quickly in other places because we have kind of laid a trail of breadcrumbs. for how Connecticut was able to do this. So we can accelerate this in your community. Matter of fact, I had a meeting first thing in the morning with the Head Start Center in Maryland that's going to take this on immediately. So we'll be meeting with the Prince George's County Housing Authority about this within the next 2 weeks. And the reality is they only have a couple of families. So you don't need critical mass. It could be one family. It could be, in this case of Connecticut, 65 families. But we really do want to see this take off nationally. And I think I should also acknowledge that we jumped onto a moving train in a lot of ways. So, you know, Barbara Duffield's been talking about this for years, and she's helped usher in partnerships that are not unlike this. So the Boston Public Schools have a McKinney-Vento, kind of their McKinney-Vento liaisons have a relationship with the Housing Authority. Minneapolis is the same. And then, of course, my favorite is the McCarver Elementary School program in Tacoma, Washington, where those families that are involved in the PTO and highly involved in their children's education are given a Section 8 voucher to help tamp down the tremendous school mobility problems that Tacoma, Washington was suffering from. So we understand that there's already research to support what we're doing, and there's really no reason to wait. So here's a little bit about how you can reach us to learn more. There hasn't really been a lot of philanthropic support for this. I mean, we do receive funding from the Annie E. Casey Foundation, for which we're extremely grateful, but we would like to see other philanthropies dive in and support this amazing opportunity to close the achievement gap in schools, to build a platform for economic security for families in your neighborhood. And the reality is we're starting with Head Start, but we could expand this to McKinney-Vento, and we will. But the better we do with these young families whose kids are in Head Start, the less of a burden there's going to be on McKinney-Vento liaisons later. So we hope that all of these kids we've worked with here won't end up needing the services of a McKinney-Vento liaison later. And the vast majority of these kids are going to be going to America's public schools. So it's just beautiful how all of this fits together. And I just, again, my deepest gratitude to all of the professionals from Connecticut who really, this fits under all other duties as assigned. I cannot believe the work that Steve, Elena, and Jen have done, and these Head Start directors and the staff. And actually, Dr. Monette Ferguson is in this picture with Steve on the slide. Bridgeport Head Start actually did a pilot on identifying homeless families that also created a nice stepping stone for us to come into the state and get this done. So just wonderful people in Connecticut, but let's tap their expertise and get this going elsewhere. So with that, I'm going to stop sharing my screen and hand it over to Erin, I believe.
Perfect. Thank you so much, Ruthie, Elena, Jen, Steve, Jacqueline, Dr. B, Barbara. I want to make sure we're acknowledging all of your hard work in making this happen. We do have some questions coming into the Q&A box that I want to be sure we're getting to. I also want to acknowledge, thank you, Ruthie, for mentioning the work that Barbara has done for a long time now to help make these partnerships happen in the K-12 side through McKinney-Vento liaisons. We shared in the chat our resource that shows how ARP-HCY, that's American Rescue Plan Homeless Children and Youth Funds, are in fact being used to unlock housing for students and their families who are experiencing homelessness on the K-12 side. And just a reminder, there are billions more through various early childhood rescue plan funds that can also, we think, be used for this as well. So I want to start with our questions. We have a few tactical questions, one big picture question that Ruthie started to touch on, and I want to give other folks an opportunity to weigh in on. The first thing I want to ask, and maybe this is a question for Steve and Ruthie first, but invite anyone who wants to weigh in here. Folks are curious about the landlord recruitment piece of this, and how can you get landlords on board? How can you start recruiting them? So I want to start there and see what additional suggestions you might have for that.
So from our perspective, it is not an easy thing to do. And I think we have a lot of different populations with a lot of different vouchers really trying to find landlords. So oftentimes we can kind of run, into each other while we're doing that, whether it's the homeless population, whether it's, the early childhood Head Start program. So it really does become difficult. And I think Ruthie will kind of respond to this too. What we really need is some dedicated people who really believe in the cause, because when you find those people, they're folks who will really go out and not stop until they find the landlords that they need. So in our case for this program, it is relatively small at the beginning, 25 households. So that is possible. When you start talking about larger landlord recruitment programs, it really does become more involved in how do we get more numbers of landlords involved? Is incentives the right, or is incentives not the right way to do it? Should we reach out to real estate professionals because they might be able to bring some folks to the table? So it really is a wide variety of different options, but I really do think the main point about this is really finding people who truly believe in that mission and just letting them go and do what they do best.
So again, hats off to Betsy and Stacy. So again, we want to train other staff to do this, but what Betsy and Stacy do is they go out and they talk to landlords. They directly talk to landlords. So it is true also that we have a campaign that we built together called A Head Start on Housing, and it's got these wonderful marketing materials. And so we can use that, and there's a website for that. But at the end of the day, we really have to get out there and tell landlords they can be a part of something quite beautiful. So the one-offs are a lot of work, but they're totally worth it. So like Betsy works on weekends. I mean, she'll go to a house on Sunday. But there's two important players here that I want to mention. One, for some of these families, Betsy has actually engaged a real estate agent. Okay, so there are real estate agents all over the country that deal with rental properties, and they receive a commission when a lease is signed. So I think most people don't know that. So that's an option. The other thing is, there are large property owners and developments like Bizzuto that we need to be engaging with, like the National Association of Realtors and Property Managers Association. So Elliot Morales, who was one of the first realtors to come into this space, or landlords to come into this space, has recommended and agreed to offered, I should say, to bring us in to do a presentation to the Connecticut Realtors Association. And what you're really saying is be a good corporate citizen, and who wouldn't want to rent to one of these families? So, but again, the key here is we're selling the robust package of services that Head Start already offers these families. And we have very high expectations for the families being good renters as well, so.
Thank you for that. I want to go back to a point, Elena, that you made, and you might be able to weigh in on this, maybe Jacqueline and Jen as well. I think folks are curious to know, how did you decide which Head Start grantees would get these vouchers? Was there any particular criteria you used? And then for the specific Head Start programs, like in Enfield's situation, how do they then decide how to distribute those vouchers among their families who might be experiencing homelessness?
Yeah, these are great questions, and ones that we really wrestled with as we kicked this off and tried to figure out how best to start this and then grow this in a very intentional and planful way, right? That we would be able to ensure that all the services and supports were in place for everybody who wanted to be a part of this. And so we agreed to start small, and there was much more interest from the Head Start community than we were able to initially be able to meet, right? Because we know that housing is one of the main challenges that Head Start staff are hearing from their families. So of course, this is something that they want to be engaged in. And so we did an initial survey out to all of the Head Start programs, asking them about their interests, asking them, about the numbers of families that are defined as homelessness that are within their programs right now, what a little bit more about the situations that they were in. We asked about their partnerships in their community with their housing partners already, and we were able to select from there, a very hard process, but select from there just the kind of ready to go Head Start programs that we started with. And so we've gotten a lot of interest and will continue to expand this statewide, because our goal is that all of the Head Starts will have access to these types of resources moving forward. So, and then when it comes to the family side of things, right, there is a limited number of vouchers and more demand, right, than there is vouchers, right? So it does make it difficult. And I don't know, Jacqueline, if you want to jump in here a little bit.
Fortunately, or I know that's the wrong term for this, but the family that we helped was the only family we currently had in our enrollment that was experiencing homelessness. Very shortly thereafter, we learned of another family, and we were like, oh, can we have another voucher? Like, we just, but we can't just steal from other people. But we would prioritize it. We had a conversation about this. So when we look at safe and adequate housing over time, right, with our family. So if a family is living in a shelter, we find that to be a high priority because we know they're doubled up, they're living in crowded conditions, likely sharing, like, for example, the mom that we were supporting was living in a smaller space with another family of 4. So it was a mom and 3 children with different difficulties of their own. And she was having to tape a boundary for her kids to stay in a certain space. They were sharing a bathroom with 14 to 16 people. I mean, all these different things, right? So that felt like it would take priority over somebody who was staying with a friend and had a bed and their own room to stay in. So we were looking at it. We had a conversation, if we were faced with a decision like that, we would look at it based on the level of safety and adequacy for the child and the family as a whole. So it really would be personalized, almost like eligibility criteria for points, just to make it fair, but also determining what the highest level of need is.
Well, and I want to jump in to say, I'm not saying that it was like a race or anything, but we're kind of on the other end of the prioritization spectrum. So we're not trying to make sure that a family is like homeless enough to earn a voucher. It's so there's some of that, because you do want to prioritize need, but we were able to sort of avoid that and focus a little bit more on what our organization likes to focus on. There's no reason to refer someone to a Section 8 voucher if they're not going to lease up. Okay, so are they so on our I hesitate to call it a prioritization form. We do have a prioritization form, but the point of it is it's got the document list attached. Okay, so like, are you eligible for a housing choice voucher? Do you have all of these documents ready to go? So a lot of people would take issue with that, but our organization's stance is, why waste the housing authority's time? Let's hustle and get those documents. But anyway, so just say that because I'm not a fan of the VI SPDAT. I wish it would be burned with fire. But it is what it is.
I think another important point here to point out is, there are other resources out in the community. And so having that communication with your housing partners is really critical also, right? So if a family is already involved with a coordinated access network or involved with another system that is, supporting housing, then that is an important conversation and piece of information to understand and know about who is working with the family currently.
Mm-hmm.
That's really helpful. Thank you so much for that, Ruthie. I wish you felt more comfortable sharing your opinion more openly. I'm gonna flip back because we're getting a mixture of questions, which is great, about the Head Start side and then about the housing side. And I want to make sure we're getting both of those perspectives in. We had a question. I saw that Ruthie, you typed the answer, but I want to make sure we're getting this said out loud. The question is, was there a discussion on offering rental assistance funding rather than, or in addition to, Section 8 funding? And so Steve and Ruthie, I'll let you two toss a coin and decide who wants to start with that.
I guess I would like a little follow-up on that, because to me, Section 8 is rental assistance, so I'm not exactly sure what the question is getting at. To me, it's the same thing. Oh, and Ruthie, we don't use the VI SPDAT anymore either, so we burned it.
Hey, yay, Steve. Everyone loves Steve, and you wonder why. Okay. So I think what Joe is alluding to is the fact that there was the state funded wraps.
Oh, okay.
First.
Gotcha. Okay,
Yeah.
so then I totally understand. So basically, Connecticut is one of, I believe, 3 or 4 states that has its own rental assistance program, which is modeled exactly like Section 8 with a couple very, very minor differences. So basically, it's state funded Section 8. So the reason why we started with the rental assistance funding, rental assistance program funding, is because it is state and it's easier for us to just do it without changing a lot of things. We have set aside for a lot of different programs. We do stuff for child welfare. We do stuff obviously for homeless. We do stuff for money files a person. We do stuff for people with IDD. So we have all these separate silos. So adding it in here was really, really easy. Managing Section 8, however, is much more difficult because you do have to go through your admin plan. You have to change that. You have to have public comment and you have to go through that process. So it takes a while. So when the commissioner said we're committing 25 wraps to this, okay, let's start tomorrow. It's not a big deal. The Section 8 took a little time. So what using the wraps really was great was it gave us that ability to pilot it, see that it was successful, really reinforce our desire to move forward with Section 8. And the Section 8 is just more sustainable over the course of time because we know that we have that funding in place, whereas state funding, we know we're going to have the funding for people who are currently there. However, getting new appropriate funding may be difficult within state budgets.
That's great. Thank you very much for that. I do have 3 more questions that I'm going to try and get in these last 14 or 15 minutes. Going back to the Head Start perspective on things, we had a question come in about how can folks in rural areas make sure that this kind of partnership and this kind of assistance is available to their Head Start grantees. And so Elena, Jacqueline, Jen, I don't know if you all want to kick us off and say a little bit about if you have programs currently that are in rural areas or plans to expand?
No, we absolutely have plans to expand, especially with the changes in the administrative plan. So we have these annualized vouchers available. We want to be able to meet rural, city, suburban, wherever there are folks that are experiencing this challenge. We want to be able to expand to those Head Starts where we're able.
And I think one of the things I can see from my perspective, what makes it different is, finding the right housing authority. So what is also good about DOH is we are a housing authority, but we are statewide. So for us, there's no difference between rural and urban. So we can place our vouchers anywhere within the state of Connecticut. So that makes things a lot easier. So then we just rely on our state partners at OEC to say, okay, well, yeah, we'll use this early Head Start in a rural place to get it going. That being said, I also understand that Connecticut is different from a lot of states. Our rural is probably not what everybody else in the country considers to be rural. So that does make a difference. I mean, we just are a very, very small state in terms of area. So our rural areas are not that isolated and, set far apart because we can drive across the state in an hour and a half.
I'll just throw one thing out there, Aaron. So some on this call may know, some may not know that the National Center for Housing and Child Welfare worked with foster youth to author the Foster Youth Independence Initiative. And this was born out of the fact that you have youth in rural areas, you have them in high, big metropolitan areas. And the youth said, we want vouchers to be delivered one at a time, wherever they're needed, whenever they're needed in the country. And they pulled it off. So FYI is extremely agile in that way. So I kind of entered this conversation in Connecticut with that in mind. So if you have a far-flung part of your state, in Connecticut, it's always Torrington. I didn't come up with that. You people, Torrington. It was
or Willimantic.
Oh, Willimantic. But it's interesting, if you look at the FYI allotments that HUD gives out, you'll see like one voucher went to Stillwater, Oklahoma. So I have that same concept in mind here. If you were in a really rural part of the US and you ran a Head Start there, there's no reason why a voucher from your state, every state does have a state housing authority. I mean, there is a way to do that. But anyway, we could dispense a voucher one at a time. Here's what I would urge you to do. Reach out sooner rather than later if you're in a rural area and you would like to investigate setting something like that up. But I want to assure you it can be done. The other thing is expertise can be loaned to different parts of the country. You don't have to immediately have a housing specialist on staff at your Head Start I don't know why I'm saying Stillwater, Oklahoma. It's really not that small of a place. But anyway, if you're in a place that wouldn't have the ability to put a staff person on this 100% of their FTE, it doesn't matter. We can help you figure that out.
That is very helpful. Thank you. I have 2 more questions. This is not our last question, so I'm going to ask our panelists to be limited in their remarks, but it came up and I feel like we should address it and give folks a chance to respond. It's about the difference between HUD's definition and the McKinney-Vento, or the definition of homelessness, which is aligned with Head Start. And if you ran into any challenges in being able to implement this and provide these vouchers to your families experiencing homelessness who do qualify under McKinney-Vento, but would not qualify under HUD, namely those who are doubled up. I'm going to put that out there and slowly back off for anyone who would like to take it first.
I think the beauty of that is because we use state funding as well as Section 8, we didn't have to come across that definitional hurdle. I think clearly we struggled with that when we were dealing with some HUD COC resources or any HUD homeless dedicated specific resources, that we really weren't able to get to that education McKinney-Vento definition of homelessness. So we weren't able to touch the doubled up population. However, when we're using the 2 resources we have now, we don't have that limitation. So because of that, it opens it up to this wider audience. And that really is how we start envisioning this more as a prevention program. Certainly we are serving literally homeless households with this because we know that they enter early Head Start as well. However, if we have someone who's at risk, who, just housing unstable, we can provide that service now. And then, like Ruthie said, it will really prevent those households from becoming McKinney-Vento education in the future. So I think just our ability to use those resources has been really key.
I would just add, this is why it's so critical to have partners from multiple sectors at the table, right? Because Steve understands at a much deeper level just how this works, how it can work. And also Ruthie, right, bringing in those expertise to the housing side, and then having Head Start at the table to be able to connect to that is really what makes this successful.
That's so helpful. I want to pose our last question, and Dr. B, I want to start with you for this question, because one of the points that Ruthie made on one of her last slides was so simple but elegant, which is you don't have to start from scratch. And so I'm wondering, for folks who may be listening to this webinar and thinking about how can I start this in my community, what already exists, what current resources are there that I could tap into? Where would you tell them to start, Dr. B? And then I want to give our other panelists a chance to weigh in.
So I think if I were starting today, I was messaging Bob on the side saying state collabs, should we get our state collab offices involved in this? I mean, we have a network in every state. So that they maybe could be a resource, but maybe a little bit of a bigger picture thing that I'm thinking about is you've got this best practice example that the concern is, if like we can do a webinar like this and there are people out there from Stillwater or wherever saying, oh, this will never work in my state because blah blah blah, right? But you've done it in other states. I heard Massachusetts, I heard Minnesota, I think. Mm-hmm. And I'm wondering if it would be a really cool project to do a crosswalk where you start with what worked in Connecticut, you list all the states, and these are the steps we had to take. But here's what won't work in Michigan because of this, and instead you have to do X or whatever. And it would take time, but build it over time so that folks on a call like this could look at a matrix and say, oh, okay, I need to have a relationship with these 3 people. They have to agree to X, and then we can move. Because I think this kind of an effort can feel very overwhelming if you don't already have your toe in the water. And it can be really exciting right this minute. And then as soon as you get off the Zoom, feel like, I don't know if I can do that, but it's clearly doable. So I'm just trying to think of how we support in order to get folks off the ground.
Others want to weigh in?
I'll just jump in and say, I ordered a booth for NCHCW at the National Head Start Association conference in Baltimore. Was that in May? And it was fun, actually. I met a lot of people, but about a third of the people that came through that little booth said, oh, we already do this. We actually have a relationship with our public housing authority. We have access to vouchers. So the thing is, it is happening and it can be very straightforward. I think where some of the people that have dialed in today are probably their housing authorities just saying no or not answering the phone. So we do need to come up with a matrix so people kind of figure out how to do this. But at the end of the day, it really is, how do you convince your public housing authority to play a role in this, even a small role, like maybe 2-3 vouchers to start with. But it's funny, Steve, like HUD used to come to our conferences and say, take your public housing authority director to lunch. And I think we're there. I think that's what you guys really need to be thinking about doing, is meeting these folks and brokering relationships. And that's, I think, we're really where you start.
And I would just do a shout out for my fellow collab directors in other states, because many times they have these relationships, right? Or they know how to get a meeting, or they know some effort that's happening and they're part of it already. And so it's much easier to build upon those already established relationships. And so if you don't know your collab director, reach out. They are a wealth of knowledge and would be more than willing, I'm sure, to help.
That's great. Thank you all so much. I'm going to pull up our concluding slides. And while I do that, Barbara, I want to see if you have any last words for our audience before I close us out for the day.
I think the only thing I would like to say, and just to comment on that last question, how to get started, it's so helpful to have somebody else who's gone first. So the work in Connecticut, the work in Minneapolis, the work in Boston, and all the people, the third of the people who came to Ruthie's table, who I wish she had their names and emails, to be able to say, hey, I attended this webinar, here are the slides, here's this blog on the Schoolhouse Connection website about what stable homes, stable families did in Minneapolis. Here's how, to have some of those examples and say, what can we do? How can we localize this, working with the housing authority, bring together early childhood in schools, and just sort of pull together what we know, because there's no need to wait until we have a great crosswalk that will help us eventually change public policy. But in the interim, let's pull together what we know and just have some local conversations using these wonderful examples.
Perfect note to end on. And with that, I will say you will receive this recording, these slides after today's webinar. I cannot thank our panelists enough for all of your expertise and all of your hard work. And just a note to say a little bit more about how Schoolhouse Connection is working in this space and early childhood homelessness in general. We do provide practical assistance to states, programs, and others who want to know more about McKinney-Vento and how to implement that in your programs. We offer data, research, and tools, including our favorite referral app for children experiencing homelessness, which is the vision of Dr. B, who is on this call, and we have been excited to pilot that across 8 states. It helps bridge connections between K-12 school district liaisons and Head Start and early Head Start programs, who, as Dr. B mentioned, are able to reserve slots for children experiencing homelessness. And in fact, we know that they are under-enrolled currently. And so we are hopeful that that will increase that enrollment rate. We do a number of advocacy efforts at the federal and state levels, and we partner strategically with our national and partners and others as well. We will have a brand new breaking news data analysis coming out at the end of October. We were generously funded by the Pritzker Children's Initiative to analyze their 20 states, and we are now able to say what the total population of children ages birth to 3 experiencing homelessness is in those states, along with their enrollment rates in the programs in which they're age eligible for, including childcare, early Head Start, and some home visiting programs. So if you sign up for our newsletter, you will be sure to be alerted when that comes out at the end of October, and we will hold another webinar about that as well. In the meantime, please do reach out with any questions. Thank you again to our wonderful panel. Thank you so much for all the work you continue to do and for your time on today's webinar. With that, I will say everyone have a wonderful afternoon, and we hope to see you soon.